Today I want to talk to you guys a little bit about knee pain. Are you guys tired of searching for treatments for knee pain that are outside of conventional measures? Have you been told in the past that you need surgery and it's either not something you want to go through, or it's something that maybe you've had a friend that's gone through that hasn't had much success? Or are you just tired of working through physical therapy and getting routine injections and trying some of these conservative measures that may give you a little bit of pain relief, but don't necessarily cut it for you in terms of really making you better? Then I want to provide you with some information about what you can do and how we can help to actually give treatments for knee pain that are going to give you much better relief, help you avoid surgery, and help you get back to the functional level that you want to be moving forward in your life. Hey everyone, I'm Dr. Sally here with Regenexx Pittsburgh, your Southwestern PA premier providers of interventional orthopedics and orthobiologic injections. All right, so first things first, before we jump into these different types of treatments, I want to talk about what sort of gets people to the point where they feel like they need these kind of treatments and how these sorts of things arise for people. So number one, most people experience usually just some basic injuries. So whether that's a trauma that maybe you experienced, whether it's a planting and twisting injury or it's a slip and fall, maybe you fell on your arm, maybe I've had patients complain about having a dog maybe pull their shoulder too hard. It really doesn't matter, whatever any of those events are that cause some additional shoulder pain. Another issue is, and kind of the bigger overarching issue, is arthritis. Arthritis is really what contributes to a large amount of pain in the population. In the knee, 95% of people usually will experience osteoarthritis in some form, and usually about 25% of people will have functional limitations because of that. In the shoulder, wear and tear over time tends to create narrowing in both the big shoulder joint and the little tiny shoulder joint up on the top that creates a lot of pain for people. That in turn can cause issues with the rotator cuff, that can cause issues with ligaments, tendons, all sorts of different things that can contribute to pain. And that's another thing that will cause people issues, is the other mechanical pain symptoms that come with arthritic changes in the joint or with trauma. Most people think that if I have joint pain, it's just because I have pain in a joint, whether that's the shoulder, the knee, the hip, the spine. The truth is, there are probably a bunch of other factors that are contributing to that pain, including muscle issues with weakness or tearing or straining, ligament issues with looseness or laxity, or maybe tears there, meniscus issues, or other tendon issues that may be creating pain that can kind of vary over time. But some people, that's even why when you have joint surgeries or joint replacements, some people even have the same pain that they had before the procedure, because the mechanics of the joint and the mechanics of the surrounding structures are not necessarily addressed. We do take extra time to also address those issues as we're providing treatments for people. So now that we know what the basics are in terms of injuries or mechanical symptoms or arthritis contributing to pain, now we can talk about what different types of procedures we can use to help with those issues. So there's two major types of treatments that we utilize when we're talking about treating arthritis or treating tears or treating other things that are affecting joints. The two big things are what we call Regenexx-SD and Regenexx-SCP. Regenexx-SD is what we consider our classic stem cell procedure. And what we're actually doing with the Regenexx-SD is we're utilizing concentrated bone marrow aspirate, where we're actually taking those samples from your bone marrow, we're concentrating it down, and we're using the cells within that to actually inject that back into the joint or back into large areas where you have problems, whether that's the joint itself or whether that's large rotator cuff tears or tears in meniscus tissue or tears in big ligaments like the ACL in the knee or other ligaments within the shoulder or the labrum that can be causing a lot of pain and problems with stability for people. With that, we're actually using those cells to improve function and to reduce pain. So those cells do create, and basically how it works is as we age or as we have injuries, sometimes the body is not great at providing the healing response to those areas like the joint or tendons because the blood flow there isn't naturally that good. So what we're doing is we're bypassing that and extracting those cells directly and then injecting them in a very precise form using very precise tools like ultrasound or X-ray guidance to place those cells directly where they need to go so that they can provide the best outcomes and give you the best functionality. Now, there are other ways that you can do these procedures where maybe providers don't utilize those same types of tools to help with putting those cells directly where they need to be. And a lot of times that results in less optimal outcomes because you need to place these cells directly where they need to go to be able to optimize the healing. Now, the other option that we have for treatment is something called Regenexx-SCP or super concentrated platelets. Now, this is very similar in practice to what people would know more commonly in the community as PRP or platelet-rich plasma. Basically, the premise of this type of procedure is you're taking platelets from the actual blood supply, you're concentrating those platelets down into very high concentrations compared to what you would see normally in the blood, and then you're injecting those platelets directly back into the area where there's tissue damage or any other structural issue that's causing problems. And basically, the platelets, like stem cells or like bone marrow concentrate, act to actually provide direct healing elements and growth factors into the areas of tissue damage. So platelets work better in a lot of ways for more minor injuries, things like chronic tendonitis or rotator cuff tendonitis, tendon issues in the knee. Sometimes I've used it for issues in the kneecap where people will have arthritic changes or other tendon issues, small muscle tears, hamstring tendon tears, Achilles tendon tears. And these types of treatments have been very, very helpful for improving tendon integrity, improving outcomes with pain, and improving patients' overall function. It's a little bit less involved in terms of how we extract those cells. Platelets come directly from the blood, from a blood draw, just like you would give at your PCP's office, whereas the bone marrow concentrate has to come from the bone marrow. But when you're dealing with more mild tendon injuries, smaller areas of tendon tears, the platelets can be very effective. If you're looking at bigger areas of pain, larger tears, larger amounts of arthritis, that's really where the stem cells shine a lot more and where people have a lot better outcomes that way. So one of the big questions that patients have is, how do these treatments differ from more conservative approaches and more traditional approaches that we would take for addressing knee pain and other joint issues? Well, number one, let's start with surgery. Surgery for the knee, surgery for the shoulder, surgery for any joint really is very invasive and traumatic. Now, I know there are different techniques where surgeons, use more of an arthroscopic, camera-guided type approach to the procedure, which is more minimally invasive than a larger open procedure, but there's still trauma that comes with that. They're still cutting through tissue. They're still maybe altering or cutting out tissue in terms of like a surgical clean out. So there are alterations that are made to the joint that may be permanent and may not actually solve the problem that you're looking to solve. These treatments that we're talking about today are much more minimally invasive. We're only using needles as opposed to using open incisions and scalpels. And I'm placing these cells that we've talked about in very precise areas and very directly in areas. And we're using guidance to avoid nerves, to avoid blood vessels, and to make sure that we get these treatments directly to where they need to be so that the outcome is the best. Also, because of that, the rehab process after these procedures is much less involved. People after these procedures are usually going through maybe a couple weeks of rehabilitation, where after surgeries, that rehabilitation may take months or even years to accomplish to make sure that we're achieving the same goals. So your rehab time is cut by about a third. So when we're talking about surgery versus these minimally invasive techniques, there's so much less risk in terms of outcomes with other adverse things that people don't want to experience, things like nerve damage, other medical issues like stroke, or even death is one thing that people will have to be very concerned about. After surgeries, those types of risks or those morbidity risks are increased by about 300%. Whereas after these types of minimally invasive procedures, the biggest problem that patients have suffered is usually just discomfort at the injection site. So you're significantly reducing risk for adverse outcomes and adverse events after these types of procedures. Another thing to compare this to is people talk about steroid shots or cortisone. And in most cases, this has been the standard of care that has been applied for knee pain over the course of the last 50 years. What we're now finding in the research is that steroids are actually causing what we call chondrocyte death. Chondrocytes are what actually make up the actual cartilage cells that create the protection of the joint inside the knee. So as you inject steroids over and over and over again, it actually causes these cells to die off more rapidly and can actually cause more damage within the joint over periods of time. Also, what we're seeing in more recent research is that these procedures that we're talking about today tend to last for much longer than the outcomes with your average corticosteroid shots. We're seeing outcomes that can last for years rather than the average outcomes with corticosteroids that are usually anywhere from a couple weeks to a couple months. And there's usually diminishing returns over time with these types of corticosteroid injections that happen pretty rapidly for patients with repeat procedures. You're getting the same amount of minimally invasive attention, you're not having surgery, but you're also avoiding further joint damage and also the other side effects that come along with steroids, things like loss of bone mass, other hormonal imbalances that can cause problems over time, and people that are fragile diabetics where it can really alter their blood sugars and cause a lot of problems that way. So with these types of procedures that I'm talking about today, the Regenexx-SD and the Regenexx-SCP, you have much lower risk of any adverse outcomes and much lower risks of pain after the procedures. You have a much faster recovery, meaning that your rehabilitation time is significantly less after these procedures. This is good for people of any age category. So I've treated anyone from the age of 14 or 15 all the way up to the age of 98. So you're not too old to have these procedures. Also, the amount of arthritis that you actually have in the joint doesn't preclude you from having these procedures either. So if you have more of that severe bone-on-bone classification of arthritis, these types of treatments can definitely be good for you. And we've seen very positive outcomes in these types of treatments with people for long periods of time. The most recent research in end-stage arthritis is showing that people with more advanced arthritic change are actually avoiding surgery 87% of the time for up to 15 years after these treatments are done. So the outcomes not only are good, but they also last for significant amounts of time. The pain levels with the procedures are very low, and your recovery after the procedures are very fast. So when we're talking about doing these procedures versus surgeries, there's definitely advantages to this, and people are getting excellent outcomes and excellent improvements in their functions. So you guys have had a chance today to hear about the different types of treatments that we do. Like I said, Regenexx-SD, which is more of our bone marrow concentrate containing your own live stem cells, or the Regenexx-SCP, which is our platelet-rich plasma type treatment that we're using for joints and for tendon issues. You have the information. I'm glad that you guys were with me today to sort of learn about this a little bit more. I would love for you guys to hear more so that you know how we can provide you with the treatments that you need to be able to get you out of pain and back to the level of function that you want to be at. If you subscribe to this page, like this video, comment in the comment section below. We can reach out and answer any questions that you may have. But also, we're going to go through some more videos that are going to help you learn a little bit more about these procedures, and we're going to give you some additional information to help to continue you on your journey to getting better. What you can do today is give our office a call. Our number is 412-963-6480. You can talk to our regenerative representative. She'll get you set up on the schedule to be able to come in and actually see us for an official consultation. And we can talk more about what you're experiencing, whether it's shoulder pain, knee pain, hip, back. We treat it all. So don't feel like you wouldn't be a candidate for these procedures or that there's not something that we can do to help you. Come in and get your questions answered and come in and see us so that we can definitively let you know what we feel like we can do for you.